Hello again, everybody. It's after work. It's 3 o'clock in the afternoon today, and I'm pretty much done. I've got a little bit of paperwork to do when I get home, but managed to carry out 4 visits in a pretty timely fashion. I've had some really busy days lately. I had one day recently where I did 7 visits. I had a day where I did 6 visits. I've been getting out at like 5 or 6 p.m. a couple of days. So I've been like kind of running around, which is okay. I got a lot of stuff done. I got 2 hours of overtime, so that's kind of nice. And, part of the reason for it was that I had a low caseload for a while, so I got a whole bunch of admissions all at once, and I just had to like run around and get everything set up and on a nice routine. And now I think everything's settling down a little bit, so that'll be nice. Of course, now that I've got everything settled down, there's a holiday on Monday again, which is going to throw off my schedule, kind of. Although not too much, because I had a medical procedure this past Monday, so I wasn't working that Monday. So that's going to kind of throw off my schedule again a little bit. And that was pretty interesting. I actually had intravenous propofol for the first time. For those of you who are not familiar with propofol, that's the drug that supposedly killed Michael Jackson. And our little pet nickname for it in the medical profession is Milk of Amnesia. And man, does it deserve that name, because one second I was looking up at the doctor, pushing the propofol into my arm, and he smiles at me, and the next thing I know, I sit bolt upright in the recovery room, and I'm like, whoa, what just happened? But yeah, total, like, no memory at all of anything that happened. I was a little apprehensive about going under that kind of anesthesia at first, because the only anesthesia I've ever had was nitrous oxide and Valium for wisdom tooth removal, which I responded well to. But never had propofol before, so I was a little apprehensive. And then the nurse who started my IV, first she tried to put it like right here, like on the side of my wrist, and I got this intense pain in my index finger at one of my knuckles, and I like couldn't help it. I like started like shouted ouch, 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 which the nurse who was inserting the IV found kind of alarming, and she said, oh geez, I'm 2 for 2 today, which did not inspire much confidence at all. But now, even still, like a few days after the procedure, when I stretch this arm out, I can feel it. There's like a pulling, like a burning in my index finger, like along my index finger. So I don't know what that's all about. If it's still there in a week, I'm going to call them up and say, hey, what happened? But then she established a line in the antecubital, site, which I don't know why she didn't just do that first. And that worked just fine. Apparently they inject you with lidocaine first before the propofol, because propofol is like irritating or burns or something, which I guess shouldn't be surprising because it's an injectable emulsion, and the whole concept of injectable emulsions just seems really weird to me. I mean, I understand like why it works and why it's good, but just the idea of injecting an emulsion directly into the blood supply just seems kind of creepy to me. But yeah, so now I've learned something valuable about myself, that I respond well to propofol. That's a good thing to know. So yeah, my caseload's back up to I think 10, 11 patients. So I've been doing quite a bit of running around lately. I'll get up to 13, 14 soon, I'm sure. School continues to be a thorn in my side. I had a bunch of homework due last night. I was up until midnight working on stuff. We had a group assignment to do again, where we had to do a group analysis of an ethical case study, and I found it very frustrating because, on the one hand, my other 2 teammates, like they go to sleep earlier than I do, so they would upload their contributions, and then since I stay up late, I'll work on it till midnight. And I mean, for one thing, I mean, it's an all online class, so I don't really know like a whole lot about these people, except what they say in their intros. But their writing skills are just abominable. I have to like rewrite sentences, like really, really simple, like high school level composition mistakes, beginning sentences in ways that you should not begin sentences in, improper typesetting, improper punctuation, poor comma use, all of this stuff. So before I can actually sit down and write like my part, I have to like obsessively go over it line by line and fix all the mistakes that I find. And then, to make matters worse, the assignment poses, presents a case study and poses an ethical dilemma, which is a really common one. There's a family caregiver for a parent with Alzheimer's dementia, and they're needing more and more care, and she's spending less and less time with her family, and the caregiver is like really getting burned out, and she's thinking about nursing home placement, even though the patient, while they still had their wits about them, said they didn't want to go to a nursing home. So, I mean, this is a really, really common ethical dilemma that, people all over the world face all the time. How do you take care of a parent with dementia, So, my teammates, instead, the question asked in the assignment was, what are some important things for this family caregiver to consider when making a decision, And my teammates just wrote about all of the things that would be beneficial to that family caregiver. It's like, counseling support and family caregiver education has been proven to improve outcomes and blah, blah, blah. And, that's fine, but like those are things that we're supposed to consider. When the family member is trying to make an ethical decision, the things that they're considering are, what does the person want? What do the family members want? What's best for me? How do I take care of myself? And like all of those things. And those are, the aspects of the situation that are immediate to that family member. And none of the other teammates wrote anything about that. So, they all wrote sections titled like respite care and counseling and education. And they were all like one paragraph, like little blurbs. And then I wrote a 2-page blurb just titled ethical decision making, and I just like stuck it towards the end of the paper and submitted it. I'm sure we'll get 100% on it. We get 100% on everything. And then just a little quick assignment I have to do tonight for my psychology class is to reflect on an assigned reading, which is just a rehash of the same assigned reading in every class about diffusion of responsibility and the Kitty Genovese murder and stuff like that, which, a lot of the original facts are in dispute about that. Except because it's like a special Sacred Heart psychology class, the specific article that we're reading has more of a religious slant to it. But the question in the assignment is whether or not I think I would respond to emergencies any differently after reading the assignment, which I've read before in other psychology classes, and I'm trained to respond to emergencies. So I can tell this is going to be a very snide response to the question, which I'm sure I'll still get 100% on. Well, I'm back home. That's it. Time to relax a little bit, then do some paperwork. Nothing too exciting going on. We'll see what it's like tomorrow.